Which new scar technologies should I use after surgery? Imagine looking in the mirror and seeing a scar that feels smoother, less red, and more comfortable. Post-surgery, choosing the right scar treatments can make a big difference in how your skin heals. Let's walk through some of the latest options that can help you manage your scars effectively. First, silicone gel sheets are a popular choice. These are thin, flexible patches you wear over your scar. They work by creating a moist environment that encourages healing and reduces excess collagen buildup. You usually wear them for at least 12 hours a day over 3 to 4 months, but not longer than 6 months. They are especially good for raised scars like hypertrophic scars or keloids. Silicone gels are a similar option and are applied directly to the skin. They are easy to use on irregular areas and can be part of your daily routine. Both options soften scars, make them more elastic, and help reduce redness and thickness. Scar massage therapy is another effective method. It involves gently massaging the scar with your fingers or a soft tool. You should start about 2 to 3 weeks after surgery, once your wound is fully closed. Massage for about 10 minutes twice a day using a lubricant like petroleum jelly or moisturizer. This helps break down stiff collagen fibers, making the scar softer and more flexible. Regular massage can also lessen itching and sensitivity. Physical therapy techniques are helpful if your scar causes stiffness or limits movement, especially near joints. Gentle stretching, soft tissue massage, and myofascial releases can loosen scar tissue and prevent adhesions. Starting these therapies a few weeks after surgery, with your doctor's guidance, can improve both your mobility and the look of your scar. Laser therapy is another modern option. Focused light beams can flatten raised scars, reduce redness, and soften the skin. Different lasers target specific issues. Vascular lasers reduce redness, while fractional lasers resurface the skin. Laser treatments are often done after the scar has matured, which is usually several months post-surgery. They typically requiring multiple sessions and are performed by a dermatologist or plastic surgeon. In some cases, if scars are causing significant problems or are very visible, surgical scar revision might be recommended. This involves removing or repositioning the scar using techniques like excision, flap surgery, or Z-plasty. These procedures are best done once the scar has fully healed and matured. Other treatments include topical creams with ingredients like vitamin E or cocoa butter, which can help keep the skin moisturized and comfortable. Pressure therapy, using special dressings or garments, can also help flatten larger hypertrophic scars. Emerging options like ultrasound therapy and electrical stimulation are being studied for their potential to improve scar remodeling, but they are less common outside specialized clinics. Remember, always check with your surgeon or rehabilitation specialist before starting any new treatment. They can guide you on the best timing and combination of therapies based on your specific scar and healing process. Consistency is key. Using silicone sheets or gels daily and performing scar massage regularly over several months can lead to noticeable improvements. Protect your scar from sun exposure with sunscreen or clothing, as ultraviolet rays can darken scars and make them more noticeable. In the end, combining treatments like silicone therapy, massage, and physical therapy often provides the best results. Laser therapy and surgical options are available if your scar remains problematic after it has matured. Following your healthcare provider's advice will help you achieve the best possible healing and appearance.